Let's talk about the treatment that is most overlooked when it comes to dealing with chronic pain and chronic stress. Let's dive in. In my private practice here in Seattle, I deal a lot with chronic pain. That could be from low back pain, knee pain, arthritis, autoimmune conditions, rheumatoid arthritis, etc., etc. And as an acupuncturist and naturopathic doctor, I'm often not the first practitioner that my patients have been to. And the biggest thing I often see missed is not acknowledging or not accounting for the mind-body connection, especially when the patient or the client is chronically stressed and their pain usually flares when they get stressed out. And that usually starts this chronic pain, chronic stress cycle that I see quite often. Now, let's talk a little bit about why this happens and also how we can break free or how we can change this. One of the first things we need to acknowledge is that pain is a type of stress on the body. And that can be whether it is an acute injury or a chronic injury. Generally, in response, the HPA axis is activated. We start to produce more cortisol, more epinephrine. And generally, what is supposed to happen is that the body is supposed to return to baseline within a few hours or so. However, with chronic stress, chronic pain, we are constantly activating this system. As we keep activating this system and as we keep being stressed or having more pain, we actually are starting to, in a way, train our brain into this process. One of the things that I see with a lot of my clients and a lot of my patients is that they've been in this pattern for so long, they are literally doing everything they can to reduce the pain or to avoid the pain that causes more stress. And eventually all they're doing is thinking about the pain. And that is not to say that the pain is all in their heads. But what does happen is that it literally is starting to program this thought pattern or this expectation or the fear of pain into the brain, to the point where sometimes I ask my clients or my patients, what would it be like to not have this pain? What would you do? What do you want to achieve? And a lot of times they literally look at me and say, I can't even imagine what it would be like to not have it. One of the things we know about being chronically stressed is that when an event happens or when an injury happens or when pain is flared, it's almost like taking a snapshot of that point in time, and the brain starts to just rerun this loop over and over. And it's a little bit more complicated than that, but you can think of this as just kind of training the same pathways and that mind-body connection between the pain and the injury, or the pain and the painful sight and the way we think starts to play over and over in our heads. And again, this is why so many clients or so many patients are actually just expecting to wake up with the pain. So how do I work with clients and patients in order to kind of stop this cycle? So when a patient or client comes to me and they, let's say, take, for example, low back pain. Yes, I absolutely do all the physical, matter to matter type things. I recommend PT. We do acupuncture, manual therapy, tons of cool gadgets in my office, which are all great. Maybe I prescribe something, either a medication or even supplement. I work with their nutrition to help push the more anti-inflammatory pathways. But what I also do is talk about mindset and mindfulness and how that can play a role in our perception of pain, especially chronic pain, and how mindfulness can also help break out of that chronic stress pattern. And usually when we do that, we start to see the pain levels decrease as well. And I talk about, we're firing and wiring the same pathways over and over, and we need to basically learn a new pathway to think about what does the pathway look like when we don't have pain, which often sounds like a bunch of mumbo jumbo or a lot of woo-woo type feeling. But I promise I have literally seen people go from really chronic pain after they've done all the things, all the injections, all the medications. But once they address their mindset and what they've been thinking, then that's when the pain started to go away. So one of the ways in which I do this is, of course, working with meditation and mindfulness practices. This is first how we become aware of what we've been thinking over and over. Many people will say they can't meditate because they can't quiet their thoughts. Well, at first, you need to kind of look at all the thoughts that come to the surface. What have you been thinking about over and over? This awareness is often the first step to eventually being able to decide what you actually want to think about. And that, in this case, may be living without pain. When we are doing a practice like meditation or other mindfulness practices, there are a couple of things happening. One, we are stopping or putting a brake on the sympathetic nervous system. We are trying to go into that parasympathetic state. And in this state, what happens mentally is that we often start to change our brainwave patterns. We go from a stressed out high beta brainwave pattern to an alpha state. This is where we can actually learn, we feel more relaxed, and we kind of are able to hack into our parasympathetic nervous system. When we get into this mode, we're able to retrain the way we think. We're able to stop dumping so much cortisol. We're able to think a little bit clearer. We're able to break into that connection of the fear and pain pattern when we get to this state. And breathing exercises is another way which we're often able to, again, hack into this sort of parasympathetic state and calm down the nervous system so that we can, again, start to think in a new pattern. So when people come to see me, they're often surprised that, even though they have back pain, I'm talking about their mindset. And one of the things that I do with my clients inside of my coaching program, the Better Health Blueprint, is to figure out ways to adopt this habit, to figure out what are the obstacles, to actually teach them how to meditate or how to do breath work so that they too can then stop this pattern. If you would like to learn more about how to work with me inside of that program, you can click on the link in the description box and you can learn a bit more. I also wanted to share with you 2 great resources that talk about the mind and body connection, especially when it comes to stress and pain. And that is one, Becoming Supernatural by Dr. Joe Dispenza. And the second book is called The Way Out by Alan Gordon. I will leave links in the description box to both of these books, so make sure you check out that resource. If you have any questions, as always, leave them in the comments below. I love to answer your questions, and thank you for checking out this video. I hope that you learned something. Otherwise, I'll see you in the next one. Bye.